Welcome to Inclusion Revolution. This week on our show, we're really excited to welcome Dr. Jason Fox. We're going to be talking a lot about traditional and non-traditional medicine, whether you call that East-West, whether you call that holistic versus medical. The reality is that for persons with all types of disabilities, it's an ongoing challenge to really understand where traditional medicine, our doctor and the medications that we're all on, depending on our disability, and a holistic approach really meets. I myself have always felt there's been this invisible fence between holistic medicine and what we again call traditional medicine. And Jason's really here to help us understand where both fit, how we can negotiate with our medical doctor to better incorporate holistic medicine. And what's really interesting about Jason's perspective is the fact that he's been on both sides of that fence. He has worked in British Columbia in traditional medicine, and he's going to tell us a little more about that. And today he runs a chiropractic clinic here in Halifax. So it's really exciting to have him on, and welcome, Jason Fox.
Thank you very much for having me here, Tola.
No problem. I think what we really have to ask you first about Jason before we go anywhere is to tell us a little bit about you and why you think it's important that we're here today talking about combining both traditional approaches to medical care.
Well, I started my healthcare career, or lifestyle, I guess, probably 19 years ago. In BC, I worked as a respiratory therapist at Chilliwack General Hospital and many other hospitals on a casual or, semi-part-time basis.
And again, what was your role in those hospitals?
Well, very acute care, crisis management, member of the code and trauma teams, critical patient transport into the city, a lot of ventilator life support, work, and just...
You've sort of seen it all in terms of severity of health issues.
Absolutely. Things that are, considered both disabilities that are chronic and long-term, which are very severe and really take a toll on us as Canadians, as well as people in, critical crisis. I believe in 19 years of being in healthcare now, I feel like I've had a really good... I have a good perspective on what is going on out there in healthcare.
Okay, well, there you go. You've led to my next question, what's going on out there in healthcare. We're here in Halifax. Obviously, we care very deeply about the health of Nova Scotians. I am aware, as I know you are, that we have the highest percentage per capita of persons who self-identify as living with disability, which means those are the ones talking about it, and you and I both know so many people don't even recognize or acknowledge what they're living with is disability. So we know the numbers are high and that Nova Scotians require a lot of support from both traditional and non-traditional medicine, and I need to hear from you, what is that invisible sort of fence that I certainly perceive? Am I wrong? Is it out there in terms of what traditional medicine and our doctors are telling us and what alternatives are available?
Well, I think that's a great question because a lot of people, in Nova Scotia and in Canada look to their medical doctors. We have been saying that we've, in the last 30 years have had a decline in our healthcare system. I mean, we, as you know, Nova Scotia ranks, we just talked about this earlier, very high in a number of disabilities.
In terms of care and time to get care and the kinds of disabilities
we have the longest waiting times in Canada.
Okay.
We have the highest amount of medical doctors, I think third highest amount of medical doctors per capita.
Yet all I ever hear, Jason, is nobody can find a doctor when someone retires.
Well, we have a number of general practitioners or family practice doctors, but they're based on the amount of burden they have. To get people to specialists is really the big gap, and the waiting times for surgeries, are sometimes a third longer than other provinces.
I don't think you'll have to convince any of our listeners here in Nova Scotia that some of the wait times are highly inappropriate. I think they'll all agree. And that's why I wanted you to talk today about the importance of holistic medicine. We understand there's gaps not only in times, but in even the capacity to care for certain issues that people with disabilities have. And what I really wanted to hear from you is, why is there this resistance, because you have been on both sides of this fence, if I may say there's a fence. What is the resistance and why, and what can we do as individuals with disability to advocate better with our medical doctor to better understand how we can sort of take that separation out and really start working holistically?
We need to educate our medical doctors, okay, and that's the big thing. They get lots of education on current pharmacological treatments. I mean, there's always somebody to educate them about the latest and greatest drug for certain conditions. And as you know, Tova, I mean, most of the, every third commercial on TV when you're watching your favorite program during prime time is a pharmaceutical talking about treating some disability, from headaches to back pain, diabetes.
I keep seeing Cialis with the overrunning tub, but that's another one.
That is another one.
But I do agree. I've seen an immense amount of advertising that I never used to see for medications, and what they're doing is they're telling the patient, ask for that.
Go to your doctor and get that. So that's what people are, in our society are being shown that that's the way. It's in a pill. Your health is in a Tova is located in a pill, and I believe, okay, if we educate our physicians, there's a very small amount of, I think there's over, maybe 115 or so, at last count, chiropractors in Nova Scotia. We think we have 2,200 medical practitioners currently, okay? Tova, I've been practicing here for over 6 years. I think I've had one piece of paper that said go to a chiropractor on it from a medical physician. Yet I see a number of patients with back pain and headache and other stuff, and they've never been referred to go to an alternative care practitioner. And I think it's just they don't know. There's such a there's so many different types of chiropractic, so many different types with my field, back pain and this sort of disability. I mean, there's so many different remedies out there. People just don't know where to go to. I mean, the research is out there for acupuncture. The research is really, really out there for chiropractic and for other sorts of physical and exercise-based treatments, but medical doctors aren't pushing people towards, we should really be looking at taking care of your lifestyle condition. And I am not the best to do it because I refer people to surgeons and I give medications, but, we can use preventative measures, instruct your patients to get to the gym.
In other words, you're looking for doctors to say, I'm not the person to take care of this, but if you took a holistic approach, that might be the way to go, and that's not really what's happening, and I think we all sort of have a sense of that. And again, I don't want to generalize about the entire medical community,
of course not.
But there is certainly a sense that we aren't getting that information. The other barrier that I see my clients or persons with disabilities facing all the time is the cost. MSI will cover the meds, MSI will potentially cover limited physio, but only for a very short time, but I can assure you MSI does not cover my chiropractor, my acupuncturist, presuming I use them.
Psychologist, dentist,
physiotherapist.
Dentist.
Right. So many people, as a result, of course, have taken on additional health plans, such as myself. And they're very expensive. So a lot of the people I work with disabilities who don't necessarily have a health plan aren't necessarily working, which is where most of us get our health plans. And as a result, they're going to their doctor and saying, I need more help. But perhaps that doctor's also not referring them because they don't have the money to pay that so-called extra service because MSI does frankly not recognize it as being a basic essential medicine. Is that true?
I think so. I think most physicians are especially in Nova Scotia, very empathetic towards their patients regarding the cost of these alternative therapies. And when they don't see, they're not taught or educated about the potential benefits of these type of therapies that are, obviously the research is out there, but they're not exposed to it. So how do they properly give direction to somebody on an alternative therapy of which they know nothing about? Right? Yeah. So their confidence is very low, right? Because they don't get a lot of exposure to this, okay? So then how do you tell somebody that socioeconomically depressed, does not have the funding or the financial ability to get a private insurance plan? So they say, do you have coverage for physiotherapy? If you don't, then I recommend that you do this, and here is a prescription that may help you get through this, and hopefully it will resolve.
Because they understand there is a financial limitation, it's an imperfect world.
And pills are covered under MSI to a certain degree, so it's the cheapest, but it's not necessarily the cheapest, because people who are kept on medications for a problem, not getting, and for a period of, for a hip or a spine or a shoulder, for up to 18 months to get access to a surgeon, they are already disabled by the time they get their surgery. Therefore, we know that people atrophy if they're in pain. They get depressed. It lasts longer. The chronic pain syndrome just sort of snowballs, and then we get people that get their surgery, but how do they rehab themselves back when they don't have the funding in the first place to be able to afford to go to a chiropractor, 2 to 3 times a week initially to get yourself, or physiotherapy treatment or massage therapy? how do they get access to this? And it's access, right?
Well, that's great, because that leads to the whole point of Inclusion Revolution, as you know, Jason, is to look at tomorrow. The revolution is not where we're going to all get our guns together. This revolution is truly a revolution of thinking differently and approaching things in a holistic fashion, because I have learned, and those with disabilities I work with agree, that we really require information and understanding so we can move to the future. And the future of the Inclusion Revolution includes finding ways for people to get what they need, whatever it might be, that will make them better. And with that in mind, I'd like you to give me a couple of ideas on how people might be able to do that.
Well, I think that, we need to, just like the pharmaceutical companies are saying to patients, ask your doctor. I think people need to really, ask their doctor about, ways that they can get access, to, various types of care. I mean, patients really need to talk to political leaders and people involved in government.
We need to make a voice. And on that note, I want to take a break. We're going to be right back with Dr. Jason Fox on the Inclusion Revolution after this very important message. So go grab some healthy snacks and come right back and join us. We'll be right back.